Good. Hello, everyone. I've been very much inspired by all the presentations today and the discussions. And my apologies for not being able to be there with you in person. I really look forward to discussing with you, and I hope to be able to inspire you to take part in more of these kinds of discussions on ethics and AI in healthcare in the future. That's my goal for today. And I really want to emphasize some of the perspectives that have already been raised during the excellent presentations that we now heard from Gunnar, Jørn, Ola, and Jakob. And in order to frame the perspectives, I want to start with a little story. And I want to take you all back to what we may now think of as an early stage of the COVID-19 pandemic, early 2020, specifically February 12. On this day, the virus had not yet been identified in several Scandinavian countries, including my own country, Norway. And on this day, I was discussing data regulation and data collecting with Norwegian tech experts at the conference. Just a few days earlier, the Chinese COVID-19 close contact detection app had been described in the world press. And during my presentation, I explained what we knew about the Chinese close contact detection app and how it worked to prevent the spreading of the virus. And I asked the audience, please, would they download it? And people laughed. On February 12, it was perceived as a joke, unthinkable to have such an app. And then we discussed, would you download it if the Norwegian Prime Minister asked you to, or if the Norwegian government launched their own close contact detection app? And people were still laughing. It was so unthinkable. That was February 12, 2020. 1 month later, on March 12, the Norwegian Prime Minister announced a full-scale lockdown of Norway. And in April already, the Norwegian government launched its own digital close contact detection app called Smittestop. This app was deemed one of the most privacy-invading apps in the world by Amnesty International, worse than the Chinese version. And in June, the Norwegian app was stopped by the Norwegian data protection authorities due to its very privacy invasive design. And I'm telling you this story to remind you that a technology which was conceived as insane and unthinkable to use at one point was available and recommended to use shortly after. We can find similar examples within all sectors, where we have experienced an unprecedented emergency digitalization. Solutions that were deemed too difficult or too invasive earlier are now being widely used. And this process of adapting and implementing new technology has never been faster, and the pace has never increased more exponentially. And this is a speed that regulation cannot keep up with, and that regulation will not keep up with due to the nature of regulation in our democratic systems. So therefore, there's a constant gap between technology that we know that are safe and secure and technology that is available. And this gap can be described as a room of opportunity. If we use it wisely, we can avoid misuse. That is, we don't miss out on the opportunity to use technology to make life and the society better, right? And I really want to stress this challenge that we all face. And this challenge is how we can use technology and avoid misuse, for sure, and yet be innovative so that we can make use of the whole room of opportunity that technology provides. And with all these new opportunities that technology can provide, are we not also obliged to avoid misuse and explore this room of opportunity for a better life? So the presentations today, during them we have heard many examples of how we work to explore this room of opportunity and attempts to use it wisely. And as all presenters have shown, we cannot do it without reflections on ethics. And due to the gap of technology that we know is safe and secure and technology that is available, we need ethics more than ever. And when I talk about ethics or digital ethics, I mean, one, to analyze and understand new tech, what it can do, and two, to discuss it, how it might affect society and individuals, short-term, long-term, etc. And three, to decide how we should and must use tech to live up to the ideal AI for good. This kind of reflection is necessary because technology, as we have discussed today, is not a value-neutral tool, but at its best, a process of ethical reflection on new technology can lead to good decisions concerning the development of AI systems. And to contribute to this process, I also want to mention to you the council that I'm leading, the Norwegian Council for Digital Ethics, which is an interdisciplinary council, politically independent and no official affiliation to any specific industry. The Norwegian Council for Digital Ethics consists of professionals from different disciplines and sectors, that's important, with expertise on some kind of AI, digitalization, and ethics. And our aim is to promote an ethical and sustainable approach to the development and use of technology, like we're doing here today. And within the spectrum of health tech, ethics is constantly being discussed. I've heard one of you just mentioned that it was absent from a conference. I see that a lot, but still I think within the health sector, I find that the discussion is still going on more than within other areas where new technology is being implemented. And still, health tech is at core at the ethical dilemma of implementation. How to be able to use the room of opportunity for innovation, right? Now, the main goal of medicine has until now been to protect life and save life. The goal is not to save our way of living. But that is what technology is now changing, our way of living. Technology is changing us and our society, and we don't know exactly how and how much, but that's what we're finding out. And this is the second point that I want to stress today, that as we work with different solutions for different challenges, be it cancer screening, radiology, or treatment for eye diseases, we must not lose sight of the big picture, and that is how all these solutions change the way we live and stay healthy. And we must ask ourselves, is this how we want to be in the future? Today, we've heard several ethical challenges raised by the presenters within this scope. Ola, for example, exemplified challenges connected to bias in different ways in his presentation, and these were also important elements in the talks before lunch. And I think we had some very interesting reflections on that already today, so I don't want to spend too much time on that. The same goes for transparency, which is more debatable. And we also have several questions related to that during especially Leo's talk this morning. But I want to particularly focus on what Gunnar mentioned, the room of opportunity that cancer screening and the camera pill can fill, that is more equality in healthcare due to the worldwide availability within cloud-based analytical facilities and which they provide. And he also mentioned this very important perspective of the end user and patient and relatives collaboration, which, as you remember very well, were elaborated by Jørn. A similar challenge was mentioned by Jakob in his presentation on the use of AI in treatment of eye disease. And just to mention that, Jakob stressed the point of keeping the big picture in sight. As he mentioned, ethical dilemmas like the risk of missing eye disease and the risk of not detecting non-related diseases. This is a very important challenge connected to trust, which we have mentioned today, but I would like to emphasize that once more. We need to trust the solutions, otherwise the solutions will not be used. And I want to elaborate on this point. This is also an important point in a project that I am working with at the University of Agder, STACEF, is it called, where we use non-invasive sensor technology to monitor inpatients with a high risk of suicide and self-harm. Now, several other surveys have shown that in general, people who are familiar with AI and who have advanced computer skills have more confidence in the capabilities of technology and are more willing to accept the use of AI systems in healthcare. Hence, we already have a bias here. Firstly, we can assume that most of us here today are in this group. Our discussions of the ethical challenges is loaded with this positive attitude. Secondly, we can assume that the solutions we produce fit very well with our knowledge of AI and our expectations to AI solutions. However, we are not necessarily representative for the common end user. Recent research indicates that most patients are reluctant to use healthcare provided by medical artificial intelligence. And this is the case even when patients are told that the medical AI outperforms human doctors. Now, why is this? One common explanation is that patients believe that their medical needs are unique and cannot be adequately addressed by algorithms. Even if the patients believe that AI provides better care, even if they know that AI is not costlier, less convenient, or less informative, they prefer the doctor. The resistance to medical AI has been connected to the common belief that AI cannot consider the individual's and his or her characteristics and circumstances, and that it therefore cannot meet the unique character of the individual patient. I don't know if you recognize or can relate to this feeling, but as the researchers found, people often view themselves as unique, and this also includes their view on their own health. For example, other people experience a cold, but my cold is unique. You know the feeling, or have you heard the statement? it's quite common. And many people see medical care delivered by AI providers as inflexible or too standardized, suited to treat the average patient, but inadequate to account for the unique circumstances that apply to an individual. And this might be an important factor when we ask or expect people to include and say yes to AI-provided healthcare. We also see that people are reluctant to let algorithms make decisions about them and important life choices. So how can we overcome the need for better branding of AI, which we have in this room maybe? How can we enhance trust? While developing AI systems and ethics, we must make sure that the conversations are interdisciplinary enough and as cross-sectorial as possible, and that it includes all kinds of stakeholders, not just the experts of AI, not just the experts of medicine and of ethics, end users, representatives like we have today in the panel, but more of this. I think that more interdisciplinary perspectives should be brought also into the training of persons working with AI systems. And in particular, I'm thinking about ethics and the perspectives of diversity and of power and responsibility. And this is something that I hope that we have time to discuss later today. Do we need a version of the Hippocratic Oath, not just for the doctors involved in the development of AI systems in healthcare, but also for the programmers? Would that help us in the situation, as Ole mentioned in his SWOT analysis, where the powerful tech companies make ethical, questionable decisions? With this question, I would like to challenge you all to take part in upcoming interdisciplinary and cross-sectoral discussions on digital ethics, and to make sure that as many voices as possible are invited and being heard. Thank you very much.